Now to our GMA cover story and more on keeping yourself and the people you love safe during the coronavirus pandemic. I want to bring in my doctor, Dr. Gail Roboz. She is from Weill Cornell Medicine and the New York-Presbyterian Hospital. She sees hundreds of patients with compromised immune systems. That's a vulnerable group that benefits greatly from social distancing. Let's put it like that. She joins us now from her home here in New York. Gail, it is always so good to see you. Thank you. I know that there's a message that you wanted to get out. First of all, I'm glad that you and your family, everyone, is doing well. You're on the front lines. You're there in the hospital. You're there with your patients. Just help people understand the importance of social distancing.
Hi, Robin. Good morning. You know, one of the main problems with social distancing is that everybody is focused on the social, not the distance. And the problem is that it started out a little bit too cute. Elbow bumping and toe tapping. We are way past that. Unless your arms are 8 feet long, I don't want any elbow bumping. We really, really have to keep that distance. If somebody can sneeze on you or cough on you, you're too close. We need help in the hospitals. We've got to slow down the absolute tsunami of patients coming in. We've got to slow down so that we can do our work, figure this out, get drugs that are helpful, but we don't have them yet. So what we need from the world is to help slow it down and take social distancing seriously, the distance, not the social.
And you feel it's not too late to flatten the curve?
It's not too late. It's not too late. We need people to really focus on that person in your life you want to protect. Everybody's got one person at least that you want to protect. You can't protect that person if you don't focus on how you would protect yourself. And think about the ripple effect. You go into the hospital, you're encountering how many people when you walk through the hallways of the hospital. Then if you're coughing, once we get you home, then the maintenance crews have to come in and clean that room up. Well, they have families too that they need to protect, and those families are trying to stay home. It is a ripple effect, and we all need to do our part. We want our lives back, and I think the way to get there is to take this very seriously. Panic never helps. It never helps anybody. But if you don't have any fear of this at all, then my worry is that you're not doing your part in helping us slow down so that healthcare can catch up and take care of you.
We know the situations in hospitals where you are and all around the country, how overwhelmed you are. We also know that people get sick, and it may have nothing to do with the virus, and they're being told, of course, to stay away from the hospital. So there's something called telemedicine that you wanted to explain to people who fall into that situation.
Absolutely. You know, coronavirus and COVID did not cure appendicitis. It didn't cure heart attacks. People still need to have babies. We've got to have room in the hospital to treat everything that we normally do. But telemedicine is helping so much. And I have to tell you, I'm on the phone, video, email, texting 24/7. to try to help people stay out. I'm lucky because Weill Cornell Medicine and New York-Presbyterian have been very much ahead on this. We can do virtual visits. There are hotlines set up. I think you guys are actually going to have links on your website to how to get onto the COVID hotline, how to get a virtual visit. Let us have a look at you before you come into the hospital. And in particular, if you're coughing or you're sick, don't come into the hospital unless your symptoms are really, really severe. Call us, reach out to us, let us take a look, let us keep you home so that we can take care of you at home and keep the hospital for the patients who really need to be in the hospital.
And like you said, on our website, we're going to provide information because people are going to want to know about telemedicine. Finally, we hear oftentimes about people with underlying conditions. I mean, I had a bone marrow transplant, as you are well aware of, which compromised my immune system. Just explain more about the underlying conditions and why that puts people more at risk.
So, you know, one of the reasons why I think people are partying on the beach is because they think this is only something that can affect you if you're immunocompromised or if you have underlying conditions. Young, healthy people are getting affected too. That said, patients I treat, hematology, oncology patients, cancer patients, patients with underlying respiratory or cardiac disorders, patients with diabetes are at increased risk. And basically, these are the patients we need to really, really, really focus on protecting because they will not be able to withstand infection with the virus, and we don't have a cure yet.
All right. So I heard your advice, and we have been telecommunicating a lot. And so because of your advice and because of what's going on here in New York City, this will be my last day in the studio, and then I will
for a little bit,
and I'll do like everybody else. Thank you, Gail. Thank you very much. I'm glad that your family and I know you have elderly parents, and I'm glad that they're all doing well, and appreciate all the help that you give to all. But as I was saying.